There is perhaps no rise more troubling than the spike in COVID cases among children. Inside some pediatric units, beds are nearly full and kids are sicker than ever. In just the past week, there's been 121,000 new child cases. The stunning explosion in hospital admissions spiking some 300%.
I've seen some of the sickest patients I've ever cared for in the unit over these last couple of weeks, critically ill children.
At Arkansas's Children's Hospital, every number is a name. The tenfold increase in weekly cases nationally is measured one family at a time. Doctors say low vaccination rates, the Delta variant, and loosening restrictions as kids return to school could turn their crisis into a catastrophe.
It's not one of those things where you can say, oh, my kid is healthy, so we're going to be fine. We can't predict which kids are going to end up here in the ICU with us.
With less than 13% of children fully vaccinated, it could be months before those under 12 have a vaccine. And just as kids return to school, in Nashville, some 1,000 students are in quarantine or isolation after an outbreak in infections. In Florida, one school district has more than 8,000 students and staff also in quarantine or isolation.
While children are far less likely than adults to be infected with COVID and to die from COVID, the numbers are trending in the wrong direction.
Doctors say most kids never get seriously sick, but many of those that do are fighting for their lives. Tonight, protecting the youngest Americans as far too many fall ill every day.
And tonight, Texas Governor Greg Abbott, a staunch opponent to vaccine and mask mandates, has tested positive for the virus. Suffering a breakthrough infection, his staff says he's receiving treatment but not showing any symptoms.